All righty. So welcome everyone to our fourth session of the United Way's Local Love in a Global Crisis Speaker Series, brought to you by University of New Brunswick. Today we'll be discussing mobility and disability under a state of emergency. Just a few housekeeping items. If you're not speaking, please keep your mic muted. This video is being recorded and live streamed to Facebook. And if you don't want to be part of the recording, we recommend keeping your video off for the portion of the session. Verbal questions can be asked at the end, or if you have questions throughout, just throw them in the chat and we'll make sure those get answered at the end. I would also like to start with acknowledging the space we are in and the land we are on in this beautiful region that we live and get to call home. We are located along the beautiful banks of the Woolstook River, the unceded and unsurrendered Mi'kmaq and Woolstook territory, signatories to the peace and friendship treaties, and members of the Wabanaki Confederacy. With that, I would like to recognize and welcome everyone who is on the line today, whether here on Zoom or on Facebook. Once again, today's topic is mobility and disability during a state of emergency. As University of New Brunswick is a major sponsor of this series, we are very grateful to be able to have them as our sponsor and partner with them and other community organizations who are continuing to adapt during these times to ensure our families, friends, and neighbors continue to have access to the support they need. We may be physically apart, but our communities continue to be stronger when we work together. So now I will pass it over to Roxana Atkinson, our Director of Community Impact, who will be our moderator today.
Hello, everyone. Thank you, Kate. So it's my pleasure to be here with three wonderful speakers with agencies that work with United Way very closely, and we've been very proud to support all of the hard work they've been doing. So I'll start with Erica Young. Erica Young is the Executive Director with Opal Family Services. Opal coordinates respite care and provides social and recreational programming for children, youth, and adults with disabilities. Erica studied health sciences and social work and has thoroughly enjoyed the opportunity to work in the nonprofit sector. She enjoys living in New Brunswick to be close to family, enjoying the great outdoors, and has recently started fostering 2 young children. Then we have Guna Kulasa-Jaram, and he is the Executive Director of Jobs Unlimited. Jobs Unlimited serves adults with intellectual disabilities with employment and work experience opportunities in the Greater Fredericton community. Guna has been with Jobs Unlimited since 1987 and started as a one-on-one job coach. Over the years, he has held different appointments within the organization, including managing and driving for a York Street Courier, an employment counselor in the vocational employment program, and manager of contract services HR for 14 years prior to being appointed as the executive director in 2017. And then our final speaker is Christy Ewart, and as the director of children and family programs, Christy is responsible for the development, management, and evaluation of programs initiatives related to supporting children and adults with an intellectual disability and their families at NBACL. She completed her education degree in 2008 from St. Thomas University. She has extensive experience in providing support to individuals who have a disability and their families, and has been with NBACL since 2013. So welcome to our wonderful speakers today. So the way we're going to be proceeding with our speaker series is we have a series of questions, and we will go one by one with the questions. We'll pass it on to our panel here. And if at any time any of our audience members has a question, please feel free to write it in the chat box. Our Katie will, or Kate, sorry, I work with her all the time, and you think there's so many Katies in our lives. So she will be very happy to help moderate the questions. So let's get going. So first question, how did the early days of COVID-19 crisis impact your clients' well-being and your ability to support them as a community service?
I can start off. Hello, everyone. It's Christy Ewart from MBACL. So like Roxana said, we support individuals who have an intellectual or developmental disability. And we do this by creating opportunities and building capacity within our communities so that all New Brunswickers can have a sense of belonging and a place within their community. When the entire province was isolating themselves, we as a support organization really had to creatively change the methods and vehicles that we use to support people. Our support is typically done in person, and this just couldn't be done. So we had to invest a lot of time in doing support such as wellness checks. We've done a lot of wellness checks and continue to do so, even though we're slowly moving into the recovery phase here in the province. Virtual visits with those that we support, just to ensure that they still have some sort of connection to people in their community and to their networks. Phone calls, and then certainly still some in-person visits when it could be done safely and following the protocols. What we found as an association is that as new guidelines and protocols were being messaged out to the community, we really recognize the importance of ensuring that those that we support have a good understanding of how to keep themselves safe, but also how to keep their neighbors safe. And so we worked with many individuals in just reviewing the protocols, reviewing the guidelines, and the why behind them. So why is it important to social distance? What is social distancing? Those types of things, and ensuring that they had a good understanding of what was expected if they needed to go out into community, or if they were visiting with someone within their network. So we certainly invested a lot of time that way in just ensuring that the protocols were followed and understood. We also worked very closely in looking at the mental health of those that we support. I mean, this pandemic, I think, has impacted all of our mental health in some capacity. And when we look at mental health and vulnerable populations, such as the population who have a disability, we know that a significant number of those with intellectual disability also have a mental health concern. And so being cognizant of that and understanding that as we support them through this pandemic was really important within our organization. Oh, Roxanne, I think you're muted.
Thank you. Guna, would you like to answer the question? So how did the early days of the COVID-19 crisis impact your clients' well-being and your ability to support them?
Yes, so I'll just give a backdrop to what we do. We currently serve about 750 individuals with intellectual disabilities in the greater Fredericton community. And we have 3 specific programs, and they're all geared towards some form of employment. And we have a program that is funded through PEDAL. And this is the employment program that helps individuals who are seeking paid work, who are considered as job ready, even though they may have barriers to employment as a result of their disability. And that program is all employment based clients or individuals seeking jobs that would pay them minimum wage or higher. And then we have another program that caters to individuals who are currently receiving income assistance or social assistance, and who also want to work, and who may require some form of supervision and support more from the employer, and where we call natural support is available, and who also want to work, but for them, many of them are working within the entitlement of what they are allowed to make, up to about $500 a month. And these individuals also focus on work. And our third group of individuals, we have 82 individuals who have complex needs and require the assistance of a support staff at all times with them. And this is what we call the one-on-one program. We have 82 individuals with 82 job coaches who are also in a work environment, but for them, many of the needs are at the personal level, as a result of the complex needs. personal care and personal supervision and assistance and guidance and support is required. We were closed on March the 16th as a result of the lockdown, and we did not reopen to our individuals till June the 15th. So it was a good 3 months. And the initial phase, it came very suddenly because we funded through social development, and as soon as we got our directive from social development for us to close our operations, the initial experience on the part of our individuals that we serve was quite overwhelming. Many of the families and caregivers were not prepared because suddenly we were informing families to keep their loved ones home, and that it was the challenges were more surrounding in the area of uncertainty, the overwhelming questions and the number of doubts and just what's happening in terms of a time frame. So we were kind of thrown into a tailspin as to how to immediately change our format. As you know, we are in the human services field. We work hands-on with our individuals, especially the individuals who need one-on-one support. And for many of them, they need a lot of personal care attention in terms of toileting, feeding, assistance with personal hygiene and other activities. So there was a lot of challenges there because suddenly the pressure was put on the families and caregivers to look after their needs, because most of our individuals come to us Monday to Friday for an average of 30 to 35 hours a week. And suddenly they were expected to stay home, and not only stay home, many of their parents, especially those who are living in the parental home, many individuals who were being looked after by their parents, they were also now working at home as a result of the COVID shutdown. And so they were now having to look after their loved ones who otherwise would have been coming to Jobs Unlimited or would be in a day program with us. So this was the initial challenge, and the issues that we were facing with was all related to some form of work. There was a loss of income for those who were working for minimum wages. There was a loss of income for those who were working for a top-up. And there was a loss of personal social interaction and inclusion, a sense of, of loss to their regular routine. And many of our individuals who are in the one-on-one program who require support and supervision through their job coaches have on the autism spectrum. And for many individuals who are on the autism spectrum, structure and routine is fundamental to their daily living needs, to their daily routine. And this routine was halted suddenly, and there were a lot of concerns. I was flooded with emails and phone calls from very concerned parents about some of the challenges they were facing in the initial weeks, but they understood the seriousness of the COVID-19 protocol, but still the challenges were there. And I'll expand more as we answer the other questions, Roxana. But so the initial phase was this, and then after that, we essentially, as what was expected of us, we were obligated, we were concerned that we should keep our connections with our clients and individuals who we serve. So we took a variety of steps to do that, and I'll explain that in our next question.
Sure. Thank you so much, Guna.
Thank you.
Thank you. Erica, go for it.
Yeah, I just would like to echo what Guna and Christy were saying about the social isolation piece and the mental health piece. Like, we were also seeing a drastic increase in calls that were wider in scope than what we normally would see, in terms of it wasn't just about respite. In the traditional sense of the word respite, it was like all of families' other supports have been put on hold or, not available, and so then respite becomes like absolutely essential, and it's not just like icing on the cake, it's like part of their whole family's well-being. And then there's like the financial components that so many New Brunswickers faced around job losses or having to work from home or having reduced income in some way. And we helped families apply for EI in the early days, and then when it became CERB and navigating language barriers to accessing service. And that's, you know, not something that is in our normal scope, but that's what people were facing. Like, as Guna mentioned, a lot of agencies and social development basically shut down. Like the components that work with children and adults with disabilities were not operating. And so I think a lot of the I don't want to say burden, but the work came to the community agencies, and our workers had to be so creative, and we're a small enough organization and have, you know, remote working capabilities. So we're really lucky to be able to continue to work and find innovative ways to support families. We went and dropped things off on doorsteps and waved in driveways and stuff like that, to provide some of that like connection and just like actual support through, you know, food or grocery gift cards or things like that that were practical and much needed. Thank you.
Great. Erica, before we move forward, do you want to just take 1 second to explain what respite is for people who may not understand, or people who are going to be logging on later and will want a little bit of a definition around what that service is?
Yeah, absolutely. Thank you for pointing that out. So respite care is when a family gets a break from the 24-hour care that they provide their loved one. So sometimes it could be kind of considered like babysitting, if it's a child, or it could be like a mentor role, or it could be a caregiver providing care in their own home, or we operate a respite apartment, and the people who use our our respite apartment, that's often the only opportunity for out of the home respite that they get. So usually the client will go and stay at our respite apartment with a caregiver, a respite caregiver, in order to give their parents and their family members a break, and also allow for you know, other opportunities and some increased independence in the community for the client. So yeah, respite care can mean a lot of things, and I think sometimes it's not seen as essential, but what we really saw during those early days of the pandemic is that it is very essential to a lot of families. And then it became even more so when there was no schools and there was no work, and there was, you know, we have overlapping clients, all of these 3 agencies. So our families that, you know, their adult couldn't go to Jobs Unlimited, they were stuck at home and needing some social recreational programming and stuff, and connection with their peers. So we tried to provide ways around the protocols by having Zoom meetings and having, like I mentioned, the driveway visits and stuff like that, just to keep the connection going.
So I know with the second question, we've touched a little bit on it, but how were those experiencing accessibility supports affected when the COVID-19 related restrictions were put into place in New Brunswick?
So many people that we support here at MBACL lost access to a variety of community resources and supports that really work to help them live independently and be a part of their community. So supports like, you know, personal and transportation supports, access to specific medical supports and services, access to food, all of those resources were limited when we were all in isolation, and there were a number of restrictions put in place. And again, going back to, you know, and Guna and Erica mentioned it as well, access to supports around mental health. I mean, we also saw an influx of requests come in from individuals, from families that were really concerned about their mental health or the mental health of their loved one. Especially, you know, we all were in isolation, and that was really difficult for a number of people to understand and also to to live in isolation at this level. So, you know, access to community, you know, like Erica mentioned in Guna, activity, resources, community activity and resources had a huge impact on the population we support, because it, you know, they were ways in which individuals could get out and meet other people and be around other people and do activities, and those were very, very limited. And so how that had an impact on their mental health and well-being, how they spent their days, was something that we addressed quite frequently during the beginning stages of the pandemic, and still do to some degree as well. But any types of supports that improved accessibility, you know, a lot of concerns around the personal support workers and in-home support workers, individuals that we support. They're oftentimes, you know, especially during the early days of the pandemic, they couldn't have individuals come into their home to provide support, or like Erica mentioned, provide respite. And that takes a toll on the individual, but also on the family. And so really, you know, addressing those and trying to kind of creatively think outside the box as to how to resolve and support those requests were certainly a priority for our organization, and in the early days, and as well as today.
Great. I see a lot of nods from both Guna and Erica, so I have a feeling you've touched on a lot of the points. So Guna and Erica, however you'd like to, in whatever order, would you like to answer that question as well? So how were those experiencing accessibility supports affected when COVID-19 related restrictions were put into place in New Brunswick?
Yes, I'll go first, Roxana. More than ever, the fundamental right to have meaningful jobs in the community where we live was put on the table. It came under scrutiny more than ever. We have something that we take often for granted, you know, leaving your home in the mornings and just going out to work and coming back home. Often there's so much that happens behind the scene, especially for our individuals who face challenges both at the intellectual and physical levels. Many of them have mobility issues. Some of them have dual diagnosis of disabilities, including mental health needs. And we often forget that the human services part, I emphasize, we are in the human services field where we need to interact. We need to have that personal engagement, the personal connection, the personal touch. We need to have inclusion, and and this period of shutdown, there was no inclusion because we had this whole issue of exclusion that happened because we were required to stay away from our regular routine of work and social interaction. And I want to speak and I want to touch on the needs of the individuals that have complex needs who come to Jobs Unlimited and to some of the businesses that we created. We have 4 businesses that have been around for about 32 years each. And these businesses were essentially created because many of our clients were not able to work in the community as a result of their high needs. So we created our own small niche of businesses where our staff are there to support them. And this was their place of work. This is where they met their friends and their routine, and they shared in each other's company. All that suddenly came to a halt, the daily routine of meeting others, the social aspect, the social interaction was key. And the individuals who come to Jobs Unlimited here have complex needs where work is, even though our primary objective is work related, work for these individuals who come here who have complex needs means that they are able to leave their homes in the mornings and come to a place where they are able to interact with others and engage in activities like crafts and outings. I have 5 individuals here who are in wheelchairs. Basically, they are confined to wheelchairs and they have cerebral palsy, and they are all adults ranging from the ages of 22 to 58, and 2 of them have to be tube fed. And these individuals, as soon as they come here, our personal support staff or their job coaches, their duties are defined by the needs of the individuals that we serve. For many of them, it is the preparation of the food. Food has to be pureed, tube feeding has to be prepared. Changes are multiple changes for some individuals. They have to be kept dry. Toileting needs changes, and also they have to be held with their physical needs. They cannot be confined to their wheelchairs all day, so we have to have them out on the exercise mats to do stretches and basic physio, taking them out for walks, taking them out on outings. Two of them attend the Snoozelen room for their recreation, basically to help with their autism coping skills. And so the feeding, the cleaning, the changing, the personal care, the personal hygiene, and then the activity base, all this came to a stop. We do every Friday, all our individuals here go to one of the local businesses, restaurants for their meals. Every Friday is a big highlight of their lives. We go in a group from all over. They have gone to more restaurants than I have in my life because they enjoy these outings, even as far as to the big stop on the Vanier, to jungle gyms and the rodeo place. And all this came to a halt, and suddenly their daily routine came to a sudden stop, but the families at home were not able to replace that either, because they were not able to go out and partake in any of these activities. And I echo Christie's and Erica's comments about, especially with respite. Many of the families that I spoke to were stressed because they were unable to access their regular respite that they had before COVID hit us. So many of them come to Jobs Unlimited, but they also have respite either evenings or weekends or overnights. All that did not happen, and that is something later I will address in the remaining questions where we talk about challenges in case this happens again. We need to do something about providing alternative services, respite. And sure, you know, we as an agency, we are one of 38 agencies in the province that belong to a group known as NBASE, which is New Brunswick Association for Supported Services Employment. And so we had a lot of meetings throughout this period to see how best we could serve our clients. And we came up with a lot of interesting ideas of how to keep our clients engaged, but nothing can replace that personal human touch in this human services field. Calling someone and talking on the phone, or having a Facebook connection, or even an online Zoom meeting, in a way helps, but it doesn't really replace the day-to-day interaction. Thank you, Roxana.
Yeah, thank you, Guna. Erica, did you want to add anything?
I know there was a lot of discussion about all the formal supports that were, you know, no longer available. And I guess I would just add that there's a lot of informal supports like grandparents and other things like that that also were kind of off the table, and that there's a lot of our families that we serve that have extra health risks or just, you know, medical needs that make this pandemic a lot more scary and just difficult to navigate. And that just in general, like, because we were talking about the pandemic and COVID-19, I think whenever there's, you know, an added challenge going on, it affects the most vulnerable people in our society the most. And I think we all know, because we work in this field, like, I think there's a lot to be said about the basic lack of supports available in some areas. And not to be too cynical, but just if we're talking from an advocacy perspective, like, I often see gaps in services for our families and our clientele. So then when you add extra challenges, the problems are just amplified. And there's other vulnerable groups out there as well, but because we're focusing on disabilities, like, I think that's just something to be said. And you know, the fact that those programs in social development had like no capacity to do remote work or to navigate, I think just like speaks to the priorities, and sometimes the people with disabilities fall down like a long way down on the list of priorities. And I think it just highlights that when we see these added challenges because of a crisis, like if the supports were really well established from the beginning, then I think we'd be a little bit better off to navigate the pandemic.
Mhm. So it sounds like your agencies, your clients, your families are all, they're all being forced to this new normal. And I want to know, what sort of innovations have you developed and what continues to still be challenging at this time?
So some of the things that we've, in addition to the wellness checks that I spoke about, which essentially are just either a virtual or a phone call, connecting with the people that we support, the families that we support, to ensure that they have what they need to make it through this pandemic. What's been really interesting on our end is that in terms of how have the people that we've been supporting adapted to this new normal, it's been interesting to see that some individuals have adapted very well. And I think one of the reasons why is because, we've been talking about isolation. People who have a disability are oftentimes very familiar with isolation. They're very familiar with staying in their homes, being around a small group of people. That is oftentimes not foreign to them. And so this what we've seen is kind of this state of emergency, this general broad isolation, really hasn't impacted some individuals like you would think. And so it's interesting, but also unfortunate as well that, these individuals isolation has not impacted them at all, because it's what they know. And that's something that we are trying to be very cognizant of and working to improve that by providing opportunities to get out into the community and get connected with other people where you live. And then kind of on the flip side, there have been those who have really struggled. We've talked with a number of families in particular that have struggled and are struggling. Especially with the closures of schools shortly after March break, that impacted all families. It kind of threw everybody's routine and schedule and days up in the air. But for a family who have a child with complex needs, with a disability, it's even more of a challenge. And especially when you also remove things like respite, things like personal supports, things like other supports that their child may need, whether it's physical supports or hygiene supports, whatever the case may be. That also is an added layer of challenge and struggle. So we've really, as an organization, we've really tried to identify what the needs are that we're hearing from families and from individuals, and trying to kind of create ways in which to address those needs, whether it's looking at what type of supports can be provided to a family during a pandemic and during isolation, what types of connection and resources and supports can be provided to an individual who's really missing being out in community. I mean, we have a number of individuals that like to go to Tim Hortons, and they have a group of people at Tim Hortons every morning that they meet with and they talk with and they engage with, and that suddenly stopped. And so really trying to find ways to ensure that the mental health and well-being of that individual, for example, isn't too impacted by this complete upheaval of their routine and what they consider their norms. So we've definitely had to utilize a number of different technologies, Zoom, Microsoft Teams, video conferencing over a cell phone, ways in which to connect to people. That's a little bit different than what we're used to. We also developed and created a number of care packages for individuals who live in their own homes that we've supported, as well as families that we support through our inclusive education and family support program, who are home and feeling the effects of having no school, no supports, no resources available. And so those care packages, were delivered on a regular basis and just we're there to brighten somebody's day and provide them with a little bit of sunshine in maybe a dark day in isolation. But it was really about all of us coming together as an association and figuring out what can we do to meet the current needs of the individuals we're supporting during this global crisis.
Thank you so much, Christy. Guna, did you want to answer that question? How have you guys adapted? How have your clients?
Yeah, just before I get into that actual question itself, I just want to add a prelude to this. So once COVID hit us and we were closed essentially for 3 months, we had to come up with creative ideas how to engage with our clients. And whatever we did was definitely not a substitute for the personal interaction, as I mentioned earlier, but we still needed to keep our folks engaged to know that that we were still, there for them if needed, although it was taking a different angle. So we contacted all our frontline staff, especially the one-on-one staff who knew their clients best. And we started essentially phone calls and emails to families and those clients who were computer savvy, those who had tablets or iPhones or personal phones or electronic gadgets. And then we started a Facebook page just for the Jobs Unlimited extended family, which included our clients, our staff, our parents, caregivers, and anyone who was involved with that individual's life. So we kept posting a lot of connections there. And we created, as what Christy mentioned, we had activity packages that we created based on the individual's needs. So the workers, staff who worked with their clients knew best what their clients enjoyed for recreational activities, for entertainment in terms of hobbies and craft. So we had puzzles, we had kids assemblies, we had coloring books, word searches books, and we put cooking kits together. So we basically, my staff, we had a limit. So at any given time, 5 of us would come in the morning, another 5 in the afternoon, and prepare these kits. We put like a cookie kit where if you're making chocolate chip cookies, we put all the ingredients in a bag, labeled the ingredients and labeled the recipe, the steps to take, and put them in a package for those who enjoyed baking. We put same thing with tool assembly kits, craft kits, or even toy kits that you can put together, especially assembling woodworking kits, birdhouses. And then gardening kits was a big hit because by April, May, spring was coming in and summer. And we put basically seeds and soil and little kits together with a plastic flower pot. The dollar store was a blessing during this time. We practically emptied their shelves by buying these little kits and sending gardening kits to these to individuals who would enjoy that. And my staff, some of them were quite proactive. They started live cooking shows online where ahead of time we will let everyone know that there was a live cooking show, and my staff were doing virtual cooking shows in their kitchens. At their home, but everybody could see them baking and cooking, and it was a very good social interaction. But the sad part was not everybody had access to this. Many of our clients were excluded. Many of them did not have access to such technology or internet connection, or were not able to participate. Again, it wasn't for everyone, but we tried on that. And then NBase provided a lot of online video manuals in terms of getting clients prepared when the time came for reopening, in terms of practicing safe hygiene, sanitation rules, how to wear masks, and how to keep your social distance. The new normal, again, we took all our cues and all our directions and directives from Public Health and WorkSafe NB, including social development and NBase. We had to do a lot of prep work. We had to change things around. We had to remove a lot of furniture because we were now limited to number of people in a given space. The rule of thumb here through NBase was 12 people in any given workspace, no more than 12. But again, many of our clients need to be seated during their work or during their activities. So seating arrangement was a bit of a challenging time. We had to physically measure the social distance of 6 feet. So we had to limit that, but the social distancing and a lot of installation of new hand sanitizers and soap dispensers and things like that. And again, the protocols, the wearing of masks, And one of the biggest challenge, Roxana, that we face in the new normal when we return to work was transportation. Social development, when they refer an individual to us for services to be provided for that individual, if they require one-on-one support, often we are also expected to provide transportation to the individual. So our one-on-one job coach, their job responsibility includes picking up the individual at their place of residence and to take them to their place of work, and at the end of the day to be taken back to their place of residence. Now with these new protocols, there were and sometimes we are allowed to have up to 2 individuals, 2 clients and a staff. But with the new protocol, we were only allowed 1 individual, and the individual who we were transporting could not sit next to the staff or the driver. They had to be diagonally at the back. And some individuals need supervision while driving. And this was a bit difficult because we had to do multiple trips just to have to get individuals from their place of residence to work before we could pick 2 individuals and go to work. And and the vehicles had to be sanitized as soon as one individual alights from the vehicle. That vehicle during the initial months, especially in July, August, September, they had to be sanitized. Every time someone new enters the vehicle, that vehicle has to be thoroughly clean and sanitized. So we were spending a lot of time in the new normal, cleaning our work areas, cleaning our workstations, cleaning table. And that was time consuming, but it was also all kinds of cleaning products were coming in. And we had to be very careful because we have health and safety policy here where we are 0 tolerance to scent. We are, a scent-free work environment. And suddenly, we were being told you needed to use Javex and you had to do this and that. And some of the products were not good enough for, sterilization purposes. And there were challenges, a lot of challenges, and especially wearing masks for our clients. It is not for everyone. We have individuals who are constantly, they drool and the mask gets soaked. And so there were challenges. But one of the things I want to touch is as a result of this, we lost a lot of our traditional job sites. The hospitality sector, we had at least 12 individuals working in 5 different hotels in the city, in housekeeping, in laundry, in the restaurants. Some of them still have not returned to work. And we have people at the YMCA who haven't gone back to work. Forestry Canada, Hugh John Fleming, we have 2 people who can't go back to work. And some of the restaurants and some of the service retail outlets, they have asked our clients to not come back till the new year. But this is again, it might be changed again with the way things are. And so some of these individuals, we were not able to ask them to stay home. They still come to us, but now we have added pressure because they're coming to Jobs Unlimited. So we have extra people who at one time did not come to Jobs Unlimited. They went to their respective employers. Now these doors are closed. So we have to be very creative because we cannot have too many people in a given space. And we have to juggle the work station. So many people are encouraged to go out for walks and activities so that there's less pressure in the work area. And our businesses took a beating. Our photocopy shop, 6 Color Copy, was shut down. We lost our revenue. We lost some customers. Our courier service was decimated. Our deli, till today, we are not allowed customers in the deli. So our deli operation at the Victoria Health Center is pretty much at a loss. And so these are the challenges with the new normal. The vitamin M money that is so essential for not-for-profits like us is coming under the big gun. So vitamin M. So we are being very creative. I'll talk about something that we started with COVID, which was an online auction that we are doing.
Online auction.
Yeah. So this way, people don't need to come here and browse through. We thought of starting a thrift store before COVID, but with COVID, as they say, when doors are closed, some new doors open. And we are now doing an online. This is our 11th week of online. It's known as unlimited thrifting.
Well, that's sorry to cut you off, Guna.
Okay, go ahead.
We have limited time, so what I'm going to do is I am going to actually maybe, sorry, Erica, if we can skip to some of the questions, because there's some really interesting questions about what kind of policy recommendations we can implement to help support your agencies. And I'm wondering if we can jump there. And Erica, if you have anything to add about innovations that, or any, how you've adapted, if you want to add that now or later, we can do that. Is that okay?
Yeah, that's fine. I think we can skip ahead. You guys articulated the challenges really well, and just the fact that our families are really resilient and are accustomed to adapting to and overcoming barriers. So that is something that we saw a lot, is like their strength as well. So yeah, I'm ready to.
Sure. I'm skipping to our fifth question because of our limited time and maybe wanting to also take some questions. But in New Brunswick, we are still under a state of emergency, and a stay-home order could be reissued if we experience another outbreak. Having lived through the last stay-home order, are there any recommendations you would suggest to policy decision makers to create a safer environment for those experiencing mobility conditions and disabilities?
I don't know if you wanted me to start first, but
you go. Yeah, go for it, Erica. Yeah, go for it.
I think a lot of our families that we work with, a lot of our clients live in long-term care or group home settings or special care homes. So I just hope that there's enough staffing in place and extra staff to be able to be called in if we're experiencing like another complete shutdown like we experienced before, and also to not forget about the social and recreation needs of people living in these settings, because obviously like the health is the number one priority, but people's mental health is so important, as we said, and like having no visits or having only virtual visits, which really wasn't set up until more recently, like the first few months, families were not able to visit their loved one. And so yeah, I think that's something that I hope that policymakers are looking at, and just again, when there's already some gaps in care that's offered in some care homes, and resources are already stretched thin. So when you add a pandemic, it causes really life-threatening and terrible consequences. So I think just like a lot of resources, and what Guna said, vitamin M needs to go into providing really, really top-notch care, so that we can face like added challenges like a pandemic, and deal with the challenges of visitors and workers working at multiple facilities because they can't earn enough to live working in one facility alone. Like there's just a lot of challenges in that sector, and I think a lot of attention needs to be put there around the country, but also here in New Brunswick. And I guess I just mentioned, I think just supporting the nonprofit sector and the community programs that the three of us and many others offer to individuals with disabilities, and then all the other vulnerable groups in our community, like is so important. And I think in some ways the community agencies are able to be more flexible and able to be more creative and able to adapt a little bit quicker than government. So not to be negative, but I just think that needs to be recognized and funded appropriately, so that we can continue to do what we do to support the community.
Absolutely. Thank you. Christy, did you want to weigh in on that one?
Sure, thank you. I think in my perspective, I think it's important for policymakers to understand that a safe environment needs to be seen in a very broad context. So it's not, just the physical environment. It's considering mental health. It's considering access to supports, the role of the community that they have in supporting vulnerable population, financial supports, access to and understanding information. All of these together make a safe environment for everybody in our community. And, you know, I spoke earlier about some of the work that we've been doing in talking with individuals around what the protocols are, what they mean, how to follow them. And I think for a type of global crisis that we're in right now, I think it's important for policymakers and also community stakeholders to ensure that those who have a disability can have access to online plain language information so that they have equitable access to understanding protocols and guidelines and these types of things that they have to and that impact their daily life. You know, ensuring that people and families have home support workers that can readily access proper personal protection equipment, that they have supports to continue working, like Guna had mentioned, you know, job coaches if needed. They need to be available because people need to be able to work if they can. And also understanding ways in which to increase the community capacity. And we talk about community capacity a lot within our walls. Community capacity to provide wellness checks and to make sure that the people within your community are well and that they're doing okay, and that your role as a fellow community member is to just check in on your neighbors, and not just your elderly neighbors, which is important as well, but also your neighbor down the street who has a disability or you know, you haven't seen in a few days. Check in on them to see how they're doing during this crisis. And also, you know, the community's role in ensuring that there's equitable access to support the mental stresses that have to do with isolation and anxiety for all community members. This, like Erica mentioned, you know, this type of crisis impacts all of us, but it impacts the vulnerable populations at a much greater level. And we have definitely seen that over the last several months. So it's imperative that our policymakers are cognizant of this and ensure that when we're confronted with another global crisis, people with a disability are not left behind once more. So I think there's a number of things and components that policymakers and key community stakeholders need to be aware of, but it's ensuring that the next time this happens, or the next time something like this, something similar to this happens, we have the proper resources and supports put in place for all of our community members.
Yeah, so well said, Christy. Thank you so much. Guna, did you want to add anything to this question?
I just want to stress again, I'm going to speak from my perspective at Jobs Unlimited. We are essentially frontline workers, and our job is limited during such pandemic shutdowns because we're not able to fulfill that essential role. And I'm going to speak on behalf of families and caregivers, because that's where many of the challenges were brought to my attention. They were in desperate cry for help, and all they wanted was a few hours break through the day, just for some breathing room for themselves. And many of my staff were more than prepared during COVID to go to their homes of the clients, just to take someone out for a walk, or to take them out on a wheelchair for a walk, or just to go to get some social aspect in. But we were told from as soon as the pandemic shutdown began on March 16 that we were not supposed to have any contact with our clients. That was the policy from social development. So we did all this, the other alternative services, which we call that. But again, I think there should be made some leeway, again, under strict, precautions, of course. That we should be allowed to be able to provide some amount of respite, because I believe senior home care was not halted during the pandemic shutdown, because agencies like Kindred and Bayshore still continued providing services, and Meals on Wheels did not shut down. They were still doing what they were doing. And I think there should be some form of policy intervention here to allow given certain circumstances where the need is very acute. Especially, I have many individuals who are living with senior parents or single senior parents who needed that support. And
Mhm.
they lost their respite, and they didn't. They were at a loss, really. And I think we really need to do more. When we work with our clients, we ultimately work with their families as well.
Thank you so much. Absolutely. Everything that you have all said is it's so important. And, you know, I want to give an opportunity also to, we have questions coming in. Actually, it looks like we just have a lot of like comments saying, echoing and thinking, wow, like everything you're saying is just resonating with our audience. So we are coming up to the 2 o'clock moment here. And so instead of jumping into the last question, if there's anything between the speakers you'd like to say, to leave on, please, we invite you right now. And I want to thank you all again also for participating today. This has just been so informative, and I feel like we're going to capture some snippets out of this and blast it out there, because it's so important that the public is aware of this, of your needs and the client's needs and what we need to do moving forward. So I'll just leave it on. If you'd like to add any last comments to the audience, I welcome you to do so now.
I just wanted to say thank you to all the community members that have continued to support us, and thank you to the United Way and the Community Foundation and everyone that's been managing all of the emergency funds. It's been really helpful, and the support has been really meaningful. So thank you so much.
Thank you, Erica. Okay, so we're at the 2 o'clock mark. I'll pass it over to Kate to close up for us. And thank you everyone who was a part of today. Thank you.
Thank you everyone so much. That was such an eye-opening discussion. I definitely learned lots today. So thank you for your time. So thank you to University of New Brunswick for presenting the series, and thank you to our guests, Christy, Guna, and Erica, and Roxana for leading today's discussion. I posted our next event, session, which is on November 25th, Aging in Uncertain Times. And you can see us here this time next week with doing a similar thing. So thank you, everyone. I hope you have a great day.
Thank you
so much for the opportunity.
Thank you, Kate and Roxana and Christy and Erica.
Yes, thank
Thank
you
you.
all.
Have a good day.
Bye.
Bye.
Bye-bye.